This is a RedFM Vancouver podcast. Make sure you hit subscribe for more great content. For further info, log on to redfm.ca.
ਡਾਕਟਰ ਵਿਕਟੋਰੀਆ ਲੀ ਘੱਟ ਗਿਣਤੀਆਂ ਦੇ ਵਿੱਚੋਂ ਪਹਿਲੇ ਇਹੋ ਜਿਹੇ ਵਿਅਕਤੀ ਨੇ ਜਿਹੜੇ ਕਿ ਫਰੇਜ਼ਰ ਹੈਲਥ ਅਥਾਰਟੀ ਦੇ CEO ਤੇ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਬਣੇ ਹਨ ਔਰ ਉਹ ਮੇਰੇ ਨਾਲ ਨੇ ਡਾਕਟਰ ਲੀ ਗੁੱਡ ਮਾਰਨਿੰਗ
Good morning. Thank you so much for the invitation to have me on the show again.
Oh, thank you. Dr. Lee, July had 175 overdose deaths in BC, almost the same as June. So how is Surrey holding up to it?
Yeah, that's an excellent question. And I think I want to thank you, first of all, because I know that RedFM has been running a campaign so people can feel more comfortable talking about substance use and to reduce stigma. And I think it's by setting examples like that and encouraging people to talk about substance use that we can eliminate stigma that surround this very important crisis. And in terms of the increase in fatal and non-fatal drug overdoses in our region and Surrey specifically, our thoughts are with those who have lost their loved ones. While we've been providing actually the same level of services or in some cases a higher level of services, we have seen a decrease in the number of people using these services compared to last year. We believe this is occurring because people might be self-isolating or for pandemic reasons, they're trying to stay home instead of accessing some of these important services. Now, we have ensure that our supervised consumption sites, overdose prevention sites remain open. We've also ensured that substance use services are available, not only in person, but some through virtual means as well. And we partnered with BC Housing, in some cases, municipalities and school districts to also provide emergency response centers to reach out to vulnerable populations. So we hope that people will speak with their doctors or nurse practitioners about how to access medication and to reduce overdose risks and to prevent withdrawal.
Dr. Lee, as you know that RedFM is running this campaign so people can feel comfortable talking about it on the air and off the air also. We were able to talk to many people and many families. So now we are holding a joint panel. So we would like you to invite and we would like you to join this. Would you be able to join this?
Oh, certainly. I welcome the opportunity to join the panel and really want to acknowledge again your role and RedFM's role in opening up conversations and dialogue about this important issue. You know, there are many reasons why people use substances, and I'm sure you're hearing those stories. Sometimes it's due to poor mental health or experience of trauma, whether it's physical or mental or others. And sometimes it's because of prescribed medications that they become dependent on these. And I think sometimes it's just that people wanting to self-medicate and treat their illnesses that they lead to illicit drug use, and whatever we can do to support people who are struggling with the substance use and to ensure that people are asking for help when they need it. It's very important. So certainly more than happy to join the panel as well.
Another concern that parents has, I want to bring it to you, to your attention, is that, God forbid, there is an outbreak in one of the schools, then the children can get sick. Does Fraser Health have infrastructure to deal with the sick children?
Yeah, that's an important question. I think as all of the conversations around COVID-19 and pandemic preparedness has been going on around schools, so we've been taking extensive planning to ensure not only our hospitals are ready, but our infrastructure in public health and support systems are ready in other settings. You will probably have noted that we have been going into settings that we don't normally go into, such as federal prisons, in meat processing plants, and in this case with schools. We've been working very closely with the school districts and ministry partners, and to support a safe return to school, there's a number of key measures that we've implemented, such as increased cleaning and disinfection, cohorts to reduce number of in-person and close interactions, physical distancing, increased hand hygiene, and non-medical use medical mask use in high volume areas when you can't physically distance. I think what's reassuring for parents is that while children can get COVID-19 experience symptoms, they generally experience very fewer health impacts than more vulnerable population, those that are immunocompromised or that are older. So certainly we're doing a lot to work with the schools, the Ministry of Education, Ministry of Health, but we are also increasing our testing assessment and ability for us to go in and to work very closely with schools. So lots of work to quickly respond to any kind of concerns that the schools might have.
Dr. Lee, now the BC government is planning to hiring 7,000 healthcare workers. How many will be in Fraser Health area?
This was very much welcome news from the government and its plans to invest, I think, overall $1.6 billion in terms of fall and winter preparedness plan. Not only will it bolster the side of healthcare workers that you mentioned, but also other measures that we're taking to respond to COVID-19. I don't have the specific numbers for Fraser Health yet, but I am sure with working with partners like you, we will ensure that there'll be adequate and fair number of people that'll be allocated to our region. And we're very much looking forward to the healthcare workers' role in long-term care assisted living, as well as we're hoping that we can expand some of the work in terms of health careers access program into areas of need like home support programs that you and I have talked about in the past. And I think the program itself is called Health Career Access Program, and approximately 3,000 of these applicants who may not previously have had healthcare experience will be able to receive on-the-job training to be able to enter career path in health. So I think this is very exciting, and anticipate that we'll find out more details to share in the coming days and weeks.
Are you given the split that how many people will be working here out of the 7,000 in Fraser Health?
I haven't received that information yet. As you know, the announcement just came out last week, so we will be working with the government to ensure that we get our fair share in our region as the fastest growing and the largest, most populous region.
Dr. Lee, please give us an update about the upcoming new Surrey hospital. Are you in loop? How far it'll take? How long it's going to take? Because the Dawson Creek Hospital's business plan has been approved.
Yes, it's exciting news for Dawson Creek, and I must say I think the minister and the government made very, very ambitious plans, and we are absolutely committed and delivering to those very ambitious timelines. Really pleased with the progress so far, and of course, lots of work underway, and the teams have been working nonstop to ensure that we're meeting not only the government's timelines, but also the public's expectations, because this is an area that many people have been looking forward to for a long time.
Are you being consulted on the Surrey Hospital?
Yes, of course. We have a dedicated team that's working on the Surrey Hospital.
So the decision can be before December, or it'll take till December?
I believe we're working towards the December timeline to ensure that we get the business plans ready to go. So it's usually quite a longer timeline, 12 months to 18 months. And as you know, we've had COVID-19 wave 1 that hit us, but we've made sure and committed to ensuring that there aren't any delays because of those reasons.
Dr. Lee, as you advised us before, we're still working on this stigma campaign, and we would really appreciate if you can join us on the panel and, guide us through this. And we are keep on working on this issue because this is very important for our community, and we look forward to see you. Anything in closing?
Privileged to join as well, and thank you for your great work in this area. And if I could also note for the community, because I know that it's the wedding season, there's a lot of celebrations that have been taking place, but with the provincial health officer's plea to ensure that we stick to fixing and ensure that our social bubbles are consistent. I'd like to also share that message once more that we are seeing a lot of COVID-19 transmissions occur in private parties and settings where there are social interactions outside of work and professional and clinical settings. So we'd like to ensure that everybody takes I know that it's difficult, but takes that advice to heart, that we need to ensure that we maintain our social circles to fix and to make them consistent as we go into expansion of schools and the children going back to schools.
Oh, by the way, the Fraser Health hospitals are getting more patients now because of this smoke?
Yes, air quality. As you know, Metro Vancouver has issued air quality concerns, and as you can see outside my window right now, it's quite gray.
Yeah.
And it's concerning. So we normally do see some increases for respiratory reasons, especially those with COPD or asthma. I haven't received our reports from emergency departments as of yet, but we would expect that to occur. And again, it's important to take the recommendations from Metro Vancouver to stay indoors, to stay hydrated, ensure that if you have any respiratory symptoms, not to go outside, and at the same time, we have to make sure indoors we're not having some of those social interactions because the distancing is important. So I think we have to take into account both air quality concerns and COVID-19, which can be challenging because COVID-19, it's better to be outdoors, but in this case, we need to maintain our indoor inside as much as possible. And I think that actually really means we need to limit our social interactions at this time.
Dr. Victoria Lee, thank you very much for your time.
Thank you so much again, and looking forward to the panel.
Okay, we'll see you there. Thank you.
Bye for now.
Bye.
Thank you for listening to another RedFM podcast. Don't forget to hit subscribe and check out our RedFM Canada YouTube channel. For further info, log on to our RedFM social media platforms or visit redfm.ca.